Human beings and our brains are wired to take the pathway which works easiest. So if at all the previous approach was of getting in touch with a person, having a communication through all the senses, getting an erection, working at it until you have it to a successful conclusion, and then you have something else that basically makes it far much easier to attain that erection and sustain it, then the parts of the body that were geared towards developing that function begin going down. So somebody becomes dependent. And these are people who, I will equate it with masturbation or pornography in the young population, because they're taking a shortcut to attain sexual pleasure. Okay, it will work in the interim, but in the long term, they will now be unable to have what comes naturally. Okay, and that's how it works for most of the people. So later on, they actually begin suffering from erectile dysfunction because of inability to get these medications, because they cost money. Okay, and somebody will not always be having the resources. And even if they have the resources, with continued use, you have more chances of getting complications. That is one of the challenges of over-the-counter medications, because you are not able to monitor some of the overdosage effects unless somebody comes with the complications. And most of the complications will include, because you see, these are medications which open the blood. So some people will get some dizzy spells, some people will get headaches, some people will get a sustained erection that cannot go away. Okay, this is for the young groups of people. All right, the elderly people, some of them will have difficulties in breathing, okay, because they're already having compromised blood supply in the areas that they're supposed to go to. Some people actually get heart attacks, and some people die. Okay, so we have different strengths, okay, as and when the need arises. It's only when this one cannot sustain, cannot achieve the desired effect, that we step it up. But we do not step it up arbitrarily. We must be knowing somebody's blood pressure, what are the medication the patient is on, etc. For somebody who now decides to bypass that process of a consultation, they'll go directly, and the side effects are dependent on the dose. Okay, that is why in the urological world, we have gone to the least possible dosage that can achieve the effect is what we use, and then we increase it as we monitor the side effects. The dangers of unsupervised increments is that somebody gets subjected, they are just focused on the erection only, okay? And yet, there will be so many reasons why somebody cannot have an erection. I'll tell you. Things dealing with blood and nerves, we have diabetes high on the list, okay? We have high blood pressure, we have problem with cholesterol and lipids in the blood. We have problems which are called chronic lung diseases, which make people not breathe properly, so that they're not inhaling and exhaling well. Okay, we have people who have mental illnesses, so that they are not able to basically get the circuits in order. We have people who have injuries on the spine. We have people who have deformities with the penis. So anywhere where the process is supposed to be occurring to achieve an erection, there could be a defect, right? So when somebody is just trying to say, I'm not getting the erection, and you add medication, you are actually stressing the body while the engine might be already broken. Yes, there's no simple solution. Our system is broken down. Number one, when men have a problem involving their sexuality, they will first of all want to hide it. That is the natural position of a man. He wants to hide it until when it begins causing him distress, then he wants to talk to somebody who will direct him to somewhere where he can get help. Now, can this situation be changed? It's a social situation, because issues to deal with male sexuality were considered topics that are only supposed to be discussed in some particular areas and not in public. So that's a cultural situation we are coming from, and it's not going to change until people get more and more liberated in talking about them. So they will keep on hiding, and they will keep on sending people, and they will keep on as long as they can afford and they think they're giving a solution. The other aspect is regulation, okay? Because we have what we call a bandit industry, where people do what they want to do as long as they get money. So these pharmacies, as much as they're under the control of the pharmaceutical board, okay, they will bring in medications without any supervision. They will have people who are only motivated in selling the medicines and not actually adding value. So, and enforcing these regulations is difficult, especially in the informal areas and informal pharmacies. And that is the problem that we have. So there is a need and there's a supply. Okay? So it will be multifactorial. Enforcing rules, having the desire to do the right thing, and having society changing its attitude so that people know when they have a medical issue, it should be addressed medically. The simple answer will be to say universal health care, okay? But that's, I think it's a mirage. What we have is, we just need to have a controlled healthcare system which is regulated. I will tell you that the original Viagra was expensive, yes. But as we exist now, with the era of generics, because the patency for Pfizer expired many years ago, we have very cheap generics. You can get these medicines for as cheap as 50 shillings, okay? So the issue of cost is not so much an issue right now, right? That's just for the record. However, it still remains as the blue pill, okay? Now, when we have an orderly society, we are able to give options to individuals. Remember, I said you can be able to have an alternate, I mean, the medicines are a first-line treatment for patients with erectile dysfunction, with or without an underlying condition after assessment. Beyond the pills, is there something else that can be done? Yes, we used to have them, and even now they're there. People who use medications for premature ejaculation, okay, to deal with the erectile dysfunction. Is there an association? Yes. Who encourages this association, or who makes people believe that this is an association? It's us medics, because a lot of times somebody who comes with a premature ejaculation will also have erectile dysfunction. One thing will lead to another, okay? Premature ejaculation makes somebody be scared of having sex with a woman because he feels he is not able to be man enough. So the system begins shutting down. So yes, there are people, we combine medications for erectile dysfunction with premature ejaculation. Are there medications that can be applied on the penis to be able to have an erection? Yes, they're there. There are creams and there are lotions. We have medication which can be put into the urethra to try and have an erection. We have injection that can be instilled into the penis to have an erection. These were the old ways before the medications came in. And we also have external devices that are used to sustain the erection so that you can pull the blood into the penis. We have ways that youth, in fact, long time ago, they used to use it, using rings to put on their penises on the base so that erection becomes sustained once you have a small erection. And very popular in the earlier days, we also have implants that we put instrument. But of course, all these are fairly gross measures that most people will run away from. They'll want the simple way that is available that has guaranteed them results. And that's why they'll always go for this. And as long as the medications are available, the costs are coming down, the need is there, and the pressure is there, I don't see this ending anytime soon.